These next two slides have a lot of information. They're very overwhelming, so you don't need to know every single thing on here. What I do want you to know is that you can interpret a joint by the names. And utilizing some of the information that you've learned, you should be able to do that. So let's look at a few of these examples. The skull, we've already learned that that's a fibrous joint called a suture, and it's synarthrotic with no movement. The temporomandibular joint we haven't talked about, but we will, and it's a synovial joint and a modified hinge joint. So a hinge joint is one of those 6 subtypes of synovial joints that we'll talk about. Because it's synovial, it's diarthrotic. It allows gliding and uniaxial rotation. This one is the atlanto-occipital joint, and you don't have to have that term memorized, but if you see that, you should know that it's between the atlas and the occipital bone. It's a synovial joint and a subtype called a condylar joint. So there are a few examples of where the axial skeleton does have synovial joints. There aren't very many, but there's a few. And it's diarthrotic and biaxial. The atlantoaxial, between the atlas and the axius, is synovial and pivot, and diarthrotic and allows uniaxial movement. Again, it's between the atlas and the axis. The intervertebral joint is between the vertebrae, and it's cartilaginous and symphysis specifically, and amphiarthrotic. Intervertebral joint, the lower ones have a little bit more movement. They are synovial and plane. This would be the diarthrotic joint and the gliding joint. If you recall back to when I mentioned these in a previous video, I said they allow you to lean back and lean forward. The costovertebral joints are synovial and plane and diarthrotic. So basically what I want you to be able to recognize from these, you certainly don't have to have these memorized, but be able to recognize what bones are involved. So the glenohumeral joint is the shoulder joint. It's the synovial ball and socket joint that we just discussed. It's diarthrotic and it allows multi-axial, which will make more sense coming up. So I'm not going to highlight every single one on here. I would encourage you to look at it. The intercarpal joints, for example, are synovial, which are a plane joint. That's one of the 6 subtypes. And they're diarthrotic and allow gliding movement. So these are all the upper limb. The lower limb is shown on this slide. So if we look at the sacroiliac joint, it's a synovial joint. It's plain in childhood and it gets more fibrous as we get older. So it starts out as diarthrotic and becomes amphiarthrotic later in life. The pubic symphysis was a type of cartilaginous joint called symphysis, and it's amphiarthrotic. The coxal joint is between the hip and the femur, so it's a ball and socket joint and allows for multi-axial movement. And you can see some of those other examples further down. So subtypes of synovial, there's 6 of them, which we'll talk about coming up. One is the planar joint, one is the hinge joint, one is condylar, one's pivot, one's ball and socket, and again, we're going to go through each of those individually. So when we talk about the movements allowed at synovial joints, we first need to consider how those muscles are attached to the bones. And they're attached at no fewer than 2 points. Sometimes it's more. There's an origin and there's an insertion. So the origin is the attachment to the immovable bone. The insertion is the attachment to the movable bone. And oftentimes we can figure these out by the spelling of the muscle. So coming up in chapter 10, you're going to learn a muscle called the sternocleidomastoid. And a lot of times the origin is named first and the insertion is named second. So this is the origin at the clavicle, and the mastoid process is the insertion. So you're not going to have to memorize all the origins and insertions, but you should be able to recognize some major ones, especially from the names. So the muscle contraction causes the insertion to always move towards the origin, and it moves along different planes: the transverse plane, the frontal plane, or the sagittal plane. Because of how it's moving in these planes, that's what's going to dictate the range of motion, the ROM. So if it's just a slipping movement, we call it non-axial. If it moves only in one plane, it's called uniaxial. If it moves in two planes, it's called biaxial. And if it moves in multiple planes, we call it multiaxial. So the three general types of movements are either gliding, angular movements, or rotation. So we're going to go into the first type of general movement, which is gliding. And the gliding movements are found in places like the wrists, the carpals, and it's because there is one flat bone surface that glides or slips over another surface. And so this would be a non-axial type of movement because it doesn't even move in one plane. There's just a little bit of slipping motion. So we see it between the intercarpal joints, intercarpal bones, the intertarsals, which is in the ankles, and between the articular processes of the vertebrae. The next group of movements is angular movements, and those angular movements come with decreasing or increasing the angle. So this is where it helps if you can kind of act out these movements. So the angular movement changes the angle between the two bones and its movement along the sagittal plane. So flexion would be decreasing the angle of the joint, and extension would be increasing the angle of the joint. So if we zoom in here, if you think of holding out your arm, for example, as like an anatomical position. In this case, she is raising her arm from anatomical position and raising it up. So by doing that, it changes the angle of that joint and decreases the angle because it's getting closer to the head. So it was 180 degrees, but she's decreasing the angle. So it's always in reference to that angle. If she were to bring her arm back down, it would be extension because she would be returning to a 180-degree angle. But you can do these with multiple joints. You can also flex at your knee joint. And what she is doing here is standing at attention and pulling her leg backward. That's called flexion and decreasing the angle between the two bones. You can also do that at the hip here. So if she's standing straight up and she leans forward, that's decreasing the angle, so she's flexing. The opposite of that would be extension, where she's increasing the angle between the two bones. So returning her lower leg from here to standing straight would be extension. Moving her arm backwards increases the angle past 180 degrees. So that's extension. Moving her head back is extension. Forward would be flexion. So touching your chin to your chest is flexion. And also standing straight back up is extension. And going beyond that is hyperextension, past the point of normal anatomical position. The other example of angular movements would be abduction, adduction, and circumduction. Abduction is like abduct, to take away something. So it's movement along the frontal plane away from the midline. Adduction would be adding that limb back towards the midline. And circumduction would include all of these: flexion, extension, abduction, and adduction. So it kind of describes a limb making a cone in space. And we can see her doing these movements. And I would encourage you to do them as well. So pause the video, make the movement, and so on. So if she's going to abduct her arm, she's going to pull her arm away from the midline. She basically goes from the arm here, moving it away. Then adducting would be returning it to the midline. So abduction, adduction occur in the frontal or the coronal plane. And then circumduction is the combination of all of these. So it's the combination of flexion, extension, and it's also the combination of abduction and adduction. So it's almost like making a complete cone with the limb.